Good morning, everyone, and welcome to today's COHTAC Share and Learn Back to School Insights and Strategies for a Successful School Year. I'm going to go ahead and get us started. So, a little bit of housekeeping before we begin. So, this meeting is being recorded and will be posted on the COHTAC website and YouTube channel, and follow-up information will be emailed afterwards to all webinar registrants. Questions, comments, resource sharing, you can put that all in the chat box at the bottom of your screens. And we will be answering questions, but please just stay muted until we call on you. As always, we love feedback. So at the end of today's meeting, we'll have two options for evaluation data. And we welcome you to invite you to take the surveys. And then just the disclaimer that the presentations today are the content of the speakers and do not necessarily represent the views of the California Department of Public Health, California Health and Human Services Agency, the Office of Oral Health, or COHTAC. All right, so here's today's agenda and our learning objectives. So let me introduce today's speakers. We have a really stacked agenda and so much great content to share with you. We're going to start by celebrating all of the work that goes into back to school activities with a little reflection and some sharing. And then I'll invite Katie Conklin on the COHTAC team to walk us through the school dental program resources on the COHTAC website. And then we'll be passing the mic to Bahar Manzadeh, another member of the COHTAC team, who will lead a panel of speakers to talk about planning for the duration of the school year. Panelists will include Cherise Sprouse, the project director for the Stanislaus LOHP, the school-based oral health team at the San Francisco Department of Public Health, including Bernadette Milares, Diana Aguayo, and Marina Spiegel. And last but certainly not least, Erica Hagstrom-Dossi, the program director of the Smile Keepers Dental Program in Tuolumne County. We're going to end with a slight change in the agenda. So SCOHR, the System for California Oral Health Reporting, will not be doing a live demo or training today, but we'll be scheduling trainings for participating and non-participating schools at a later date. Instead, Stephanie Craig, a system specialist with CodeStack at SCOHR, will be here to share updates and answer some questions. I'm going to be dropping a link in the chat all about today's speakers if you have a chance to check it out. They are all amazing, and I'm so glad they're here with us today. All right, so let's get started with celebrating all of the work that went into back to school. I think it's mid-September, so I think everyone's back in school by now. But we wanted to spend some time just reflecting on how things went, what are some challenges you experienced, and tools and resources that were the most useful. So we're going to use Mentimeter to answer the questions that I have listed on the slide here. There's a link in the chat that you can click on that will take you there. Or you can use your smartphone, open up that camera, scan the QR code there, and click on the link. That'll also open up to Mentimeter. And then you can also just go to menti.com and enter that code that's on the screen. So I'm going to go ahead and switch over and invite you all to share your answers. Let me see if I can go back to Mentimeter. Okay, so the first question is, what wins would you like to celebrate with your back to school activities? You can just type in any responses in that form there, and it should populate on the screen. Finally signed an MOU. That's excellent news. Yes. One of our FKHCs is planning to reintroduce school-based prevention for varnish, sealants, and cleanings since COVID lockdown. That is a huge success. Congratulations. Signed MOUs. Yeah, that's a huge, huge deal. School dental screenings are about to start. Yes, connections with school nurses. That's vital. Wonderful. And those used with state preschools. Yes. Screened TK through third for preventive services at one school. That's wonderful. Happy to have repeat collaborative partner. Yes, and a new one. Increased COA assessment rates with passive consent. We love to hear it. Introduce Rethink Your Drink. Had a youth and family fair. Lots of Pot of the Otter books. Yay! And got the 2 non-participating schools to join COA. Yes. Volunteer dentist who's interested in school-based trainings and fluoride varnish application. Also board member of the local dental association. That's fabulous. Only one district left in OC. Yes, Orange County. That's great. Oh, this is making me so happy. Congratulations, everyone. Back to school nights. Yep. Volunteer dentist and Head Start Family Welcome Day. COA campaign in all Alameda County school districts. That's amazing. Adopt a school program. I love that idea. Thank you. And if you're just joining, let's copy the Mentimeter link again so you have it and you can join and share some of the wins from your work. I love all this. We're doing story walks in State Park with a Halloween theme. Oh, you guys are so creative. This is so exciting to see. Well, congratulations, everyone. I'm going to go ahead and move us on to the next question. But I wanted to say congratulations for all this work and all of these wonderful ideas here. I really wanted to celebrate all of you. All right, so the next question was just a way to share about any challenges that you might have experienced with your back to school activities. Could be a way to vent in a safe space. It could be a way to for COHTAC to see what some of the challenges are so that we can think about ways that we can address any of the issues with the TA that we provide. But I invite you to just think of any or all challenges and type those in the answer box. Changes in administration. Yep, that's a big one. Difficulty referring children with untreated decay who are non-urgent, limited clinical dental resources. I think you are not alone there. And welcome to everyone just joining. Gustavo, if you can drop the Mentimeter link in the chat again. We are just spending some time reflecting on how back to school activities went. Amount of time it takes to get MOU signed. Yeah, it takes a really long time, doesn't it? Change in staff. Yep. Decrease in the number of families signing up for school-based dental services. Not all schools wanting to participate. Everyone is sick. Yeah. COVID is still a thing. It sure is. Our approach is to tailor each school's needs, which is a heavy lift on the team. Yeah. That's exactly right. Short staffing. School events were scheduled late after 5 p.m. Finding resources for the communities to pay for dental care. Yeah, thank you all. I appreciate this. Lack of alignment between school coordinating staff. Some staff wanting our services and others who do not. Yeah, that's tricky. Having a hard time recruiting volunteer dental providers. Yeah. I'm going to go ahead and actually move us along to the next one, but I thank you for sharing your challenges. And I will say we will be sharing all this back with you, and it's really good information for us to get a better understanding of how COHTAC can support you in your school programs. So the last question is we might not spend too much time on it, but if there was anything that was particularly useful this year or tools that you used for your back to school activities that you would recommend for others, an opportunity for you to share um, with your peers what has worked really well for you. And maybe can give some other folks some ideas of different tools that they could use or resources. Smile California, yeah. And in fact, Smile California will have some new school readiness resources that are coming out within a week or so. And so we'll be sending those out with the follow-up to today's webinar. So you can hold on tight to that one. COHTAC, thank you. I'm glad to see that we're helpful. Connecting with family resource centers, example MOUs, and parent notification and consent forms. Yeah. Smile Habits OC. Yep. Leaning into Rethink Your Drink Month. Oral Health Puppets. Yeah. Journey Works. I think that's new for me. If you could share more about what that is, I'd love to learn more. I mean, you're also welcome to just put your ideas in the chat box if Mentimeter is not working for you. All right, I think I should probably move along in our presentation, but I'll leave this one open in case you have other ideas that you would like to share with folks. But I'm going to go ahead and go back to our PowerPoint. And just again, thank you all for all the work that you do. It's really inspiring to see, and it's really a pleasure to be able to support you. Okay, so now I'm going to turn it over to Katie Conklin, who's going to go over some of the COHTAC School Dental Program resources on our website. Katie.
Right. Thank you, Aubrey. And hi, everyone. Good to see you here. And congrats on your back to school, the things that you're working on, and all your resources. So Aubrey's going to go ahead and pull up the website and we'll share some new things that we have. All right. So welcome to the COHTAC website. We are excited to show our new school oral health programs landing page. To get to the new school landing page, you can go to the top and hold your mouse over our programs. A dropdown will show the programs COHTAC supports. Click on School Oral Health Programs and COA, and the school landing page will appear showing a yellow school bus and kids. The design of the new landing page was inspired by the school work group and resources subcommittee, whose audience focuses on resources for TK to third grade. The work groups met regularly to provide content and feedback to ensure the new web pages were easy to navigate and scope to local oral health programs. So thank you to our work groups and to Paula Lee for your leadership. And then we have a slide. Yay, congratulations. Yay. All right, thank you. And then the intro to the school landing page. Right, so schools are a place where kids learn and play. As public health professionals, we know many kids miss school due to dental problems and can have lower grades. By providing oral health resources and programs at schools, we can keep kids healthy and promote preventive oral health services. So we divided the resources into 4 areas by ages and programs: children and preschool, the kindergarten oral health assessment, the school-linked dental programs, and school-based dental programs. But before going into each of these areas, I'm going to orient you to the right-hand side of the screen, where you can find a flyer from the Office of Oral Health created by Dr. Shamaila Hashmi called Children's Oral Health Matters for School Success. The flyer highlights the missed school days due to dental problems using 2022 CHIS data. So we encourage you to share the flyer with schools to demonstrate the importance of oral health and school readiness. And then if you're interested in posting on social media, Children Now has created a social media toolkit to raise awareness about COA. Available in English and Spanish, the toolkit has copy and images you can easily customize on Canva. And then going back to the center part of our page, starting with childcare and preschool, the Brush in a Box toolkit encourages toothbrushing and early education and childcare programs to promote oral health and lifelong habits. Local oral health programs can use the toolkit to train teachers and childcare providers on how to implement a daily toothbrushing program. Local oral health programs can use the toolkit to help fulfill Work Plan 2.1.b, which is number 6 on your work plans, design an early education and care prevention program. Parts of the toolkit have been updated, and they're currently translated into Spanish since the last Share and Learn last winter. And if this is new to you, here is a link to the Share and Learn in the chat. And then if you'd like, please write in the chat if you've used the toolkit and you like it, the Rush in a Box. We'd love to hear from you. And if you'd like to connect with each other. So going back to our school landing page, to the kindergarten oral health assessment, did you know 1 in 2 kids starting school have already experienced tooth decay? COHTAC is a law and education code that requires kids enrolling in public school in their first year of kindergarten or first grade to have an oral health assessment by a dental professional. The assessment is free and quick to complete. Schools play a big role in promoting COHTAC, sending home the forms and uploading the forms into the California Oral Health System for reporting SCOHR by May 31st. And the new COHTAC webpage was written by the school work group resource subcommittee. So special thanks to you. Thank you so much. And then it was reviewed by the school work group. And if you're interested in joining the school work group or the resource subcommittee, just reach out to COHTAC or you can put your name in the chat. And we'd love to have you. So if you're not sure where to get started with COHTAC, on the right-hand side, you can find the promising practices for local oral health programs. That is a helpful toolkit. The toolkit has recommendations and resources on how to connect with schools, how to prepare schools for COHTAC and on-site screeners, and how to help schools with SCOHR. And then below the toolkit, you can find the COHTAC Starter Manual for school staff. The manual is developed by local oral health programs with valuable feedback from school nurses. You can use the manual as a template to customize and add resources. The manual outlines the COHTAC process and steps that you can find on the left-hand side of the COHTAC page. And the 6 steps provide additional information on how to implement COHTAC at a school and resources to be successful. And if you've had a chance to use the starter manual, go ahead and you can put it in the chat. Just let us know what you liked about it, how you're using it. We always love to hear back. And I really want to say this starter manual is wonderful. It's easy to use. And all the content, almost all the content that you see on the new COHTAC page is from the starter manual. So it's a great resource to have and to share with schools. Okay, so going back to the left-hand side, to review the steps, we'll highlight a few. So we'll start with step 1, COHTAC forms. The schools send out these forms at the start of the year, including the parent notification letter that has information for parents, the new COHTAC form that has more information for follow-up to care for kids with urgent dental care needs. The waiver is a separate form now that parents sign to opt out. And then we have the on-site screening opt-out letter for parents choosing to opt out of screening being completed at the school. And we also encourage you to wait a little bit and maybe send this out closer to the on-site screening day so it doesn't confuse with the waiver form. And then also on the right-hand side of the COHTAC form section, you can see that we have some forms that are translated into Spanish. And then we're working with CDE to also have more languages hopefully available soon. And then going to step 3, data. This is a really fun one. Each year, schools continuously check COHTAC data and report to SCOHR by July 1st at the latest. But to help improve the tracking process, the resource and data subcommittees created tools. So the 2 tools are the data input form and the SCOHR summary report data auto collection. And then, Aubrey, if we can bring those up separately, they're really nice Excels that you can download. So the data input form is helpful for on-site screenings. And you can see here on this tab of the worksheet that you could enter data directly from the screening that day. And if you want to code it, you can go ahead and code it so you're not using children's names. And then when you click on that second tab, it's going to tabulate those findings from the screening on the first worksheet, and it's going to put them in a nice format ready for SCOHR. And then when you go to the third tab, it's going to give you a visual of tables and graphics that are really nice to present to your stakeholders. And then the second one, Excel sheet, is the SCOHR summary report data auto calculation, which has instructions on the first tab on how to use it. And then the second tab is that you can take your data from SCOHR, download it, and then copy and paste it into here, into the SCORE summary report. And then on the third tab, it's going to show you tables and visuals. And you can compare it with all schools. And then you can filter it by your participating schools and you can compare both of those. This is a great resource that's been created by our subcommittees. If you have any questions, please reach out. And then there's also Claire from San Mateo has created a video that's available on the data page that you can watch. So thank you so much. You guys are rock stars. And then for more on the steps and resources for the school work group, the school work group is developing a video to cover each of the steps, and that will be available soon on the COHTAC website. And going back to the school landing page, the School Link Dental Programs Manual has helpful information on screenings, education, and care coordination. So we'd like to acknowledge Drs. Bahar today and Bhavana, the COHTAC and the office oral teams for the creation of the School Link Manual. And the physical copy of the PDF, fingers crossed, is coming soon. So thank you. And there are 5 steps to implement a School Links program. So we welcome you to open the steps, to see the examples and how they work. But today we're going to focus on step 1, preparation. So building partnerships and establishing a memorandum of understanding MOUs, like what you guys are saying for your wins, and also takes quite some time, is a mutual agreement to collaborate on shared action. So you can find instructions and samples of MOUs under step 1 here. And then going to step 4, care coordination and referral management. Did you know that Medi-Cal has a new care coordination form? You guys can raise your hand if you know. Some of you are using it, we've heard. But you can complete the form as part of your screening at school programs to ensure children with tooth decay are connected to a dental home. So if anyone be using the form, if you'd like to put it in the chat, what you like about it, how it's working, we'd love to get your feedback. And then for more information on that school manual for steps 1 through 3, here is the link to the Share and Learn from last year. And then going back to the school landing page, to the school-based dental programs, sealants and fluoride varnish. School-based oral health programs are an approach to bring preventive services to schools. And the 2 most common school programs are dental sealants and fluoride varnish. And when starting, just keep in mind the components of a school-based dental program cover 4 areas. So we have our screening, our preventive services, our connection to care, and our quality assurance. So we're going to be building this out more on the website and filling this in. So please continue to check back. And then as you scroll down the page, you can find information on dental sealants, equipment for programs, and best practices. And on the right-hand side, more towards the top, we have the report from from the Smile survey, the previous Smile survey, and some information from Smile California, a really nice FAQ that you can share with schools, and also a really nice systemic review by the Community Task Force. And then at the bottom of the page, the fluoride varnish section is coming soon. So we will keep you updated. But thank you so much. We hope these resources are helpful. And I'm going to go ahead and pass it to Aubrey.
All right. Thank you, Katie. We covered a lot there. So I invite you all to consider what questions you have about all of that, drop them into the chat. And then there'll be some other opportunities that I'll share with you about ways to get support from COHTAC. So here's that Medi-Cal dental care coordination form again. Gustavo will post the link. There's also a QR code here if you want to scan it with your phone and save it as a bookmark in your phone so you have easy access to it. Anyone can use the form to refer Medi-Cal members to dental care. There's a number of questions in there that you need to specify, like the tier level, the dental treatment needs, the translation and interpretation needs, and transportation needs. And we've heard that DHCS staff aim to follow up with members within 3 business days. And I know that there's a lot of questions about this, and we're hoping to invite their team to a webinar in November to share more. The next thing I'd like to remind you all about is that Medi-Cal managed care plans are required to execute MOUs with LEAs, local educational agencies, I think, by January 1st of 2025. And so the one thing that your job as an LOHP should be doing is to ensure that this second bullet point here, that the coordination and delivery of care and services is included in those MOUs. Um, Children Now has put out an excellent toolkit and some addendums and Q&As all about this. And so I highly encourage you to check out their toolkit, and Gustavo will be putting the link in the chat right now. Um, but that'll cover, from top to bottom, all the different things. And you're right, Sheree, LHJs are also supposed to be executing MOUs, I think, this year. So anyway, so there's a lot that you can be supporting as an LOHP and ensuring that these MCPs and LEAs are including care coordination in those MOUs. Okay, so here's the important slide about, if this is a lot for you, if you have questions about any of the things that we've shared so far today, we invite you to join us at office hours. So Katie Conklin from our team and Bahar Amanzadeh, also from our team, will be hosting an office hour on Wednesday, October 2nd from 10 to 11 a.m. You can drop in. You can stay the whole time. You can drop in just to schedule another meeting with somebody to follow up on something. Um, but this is just the beginning of sort of your opportunity to get more support with your school dental programs. COHTAC also hosts school open hours led by Bahara Manzadeh and Erica Hagstrom-Dossi, who's also on the call today. You'll hear more from her later. But this is really more of a small group format to facilitate your school dental programs. And there's a survey link that is in the chat now if you're interested in joining future cohorts of that. We welcome you to join us. And then if all else fails, just always email us at oralhealthsupport@ucsf.edu. Okay, I think I need to move on, but if you have questions, and I'm seeing some in the chat already, so we'll try to answer as many as we can via chat, and then there'll be some time later on to ask questions live. So I'm going to shift over to the bulk of our presentation today and invite Bahar Amanzadeh to facilitate.
Thank you so much, Aubrey, and hello, everyone. Such a pleasure to be here, and I'm here to run this panel with these amazing panelists from Tuolumne County, from San Francisco, and from Stanislaus. We can go to the next slide. As you see, these amazing partners come from across the California, and they also represent different kind of school oral health programs. As you will hear a short presentation from them, and then through the panel, San Francisco team includes some of the dental team, and they have had an oral health program from before, and now the LOHP has kind of included expanded services. So we will see how that works for them. Smile Keepers from Tuolumne County is a contractor to LOHP, and they have been doing school oral health programs from before too, and now working with LOHP. So you get to hear from an outside contractor perspective that what it takes to work with the schools and with LOHPs. And then we have a Stanislaus County that Sherry is going to share with us from a perspective of an LOHP in Central Valley, which they do not work with a contractor, but they coordinate the activities across the county with different schools and everyone. So with that said, I'm going to give it to our first presenter. We're going to do a short presentation with each, and then we will have our panel. So Sherry Strauss, take it from here.
Good morning, everyone. So just going to give some insight and strategies from our working with schools and our engagement since I stepped into the position in 2018. So we'll have a little pre-COVID, during COVID, post-COVID kind of story along the way. So next slide. So just who we are, this is our team. If you can tell, Chewy is probably our most popular among the kiddos. He is our ambassador. He is goes out to events with us, but also we bring him along with us so we can utilize him on social media to help promote the program and communicate what we do for the community. And then we also have an education campaign through social media too. So they run in tandem together, and we aim for monthly, but sometimes we're just a story instead of a true post because there's other things apparently going on in public health. So our goal is cavity-free kids, and we work together to improve oral health is our mission. And along with the statewide goal is to reduce oral health disparities among school-age children by 50%. So myself, Anna Mejia is our health educator, and then Sotir is our community health worker 3. Next slide. So just a snapshot of what schools look like, and then eligibility-wise for Stanislaus County. We have 25 elementary school districts, 72 of which qualify, so that's 18. And actually, of those, 10 of them are 100% school of their schools are eligible, and 8 have at least one or more. So out of the 25, only 7 truly have no eligible schools. So even if the district doesn't have 100% of the schools, we still want to get into those schools that do qualify, which out of our 112 schools, about 80% are eligible. And of that, only 22 are not eligible. And if you look to the other side of the screen, there is our COA data. And unfortunately, only 40% of students were assessed. And that's because out of our 46 elementary or 112 elementary schools, only 46 were reporting. We're kind of making a rebound post-COVID staff turnover. One of our biggest school districts likes to move folks around in administration, so it makes it a bit challenging for that capturing data consistently over time. But the biggest piece, I always give the cautionary tale, which I'm sure you're all familiar with, is that these numbers only represent those that are actually accounted for in SCOHR. And for Stanislaus County, it's less than half of our kindergartners currently. So some work to do there, about 47%. So we have our work cut out for us there. Next slide. So as I had mentioned, a little bit of pre-COVID, COVID times, and post-COVID, how we worked with schools and continue to grow and advance our school oral health programs. But really, it started with back to school and those one-time events. And really, we approached it from leveraging our existing partnerships or our existing relationships that we had either working in other programs or through our internal team and the cross collaboration amongst other public health programs. So we started off, we were asked to train staff and provide resources for our Healthy Start sites and our family resource centers. So we're really fortunate in Stanislaus County to have embedded throughout all of our communities family resource centers. So there are CBOs, and their staff typically are also the Healthy Start sites. It can be or they can be combined. It depends on the makeup of the community and the makeup of the funding. But they're also typically co-located with schools, which is super helpful. And then another partnership that was early off pre-COVID and that we are still working with post-COVID, or I guess COVID is still a thing, but we were able to get back into schools, is our Head Start program. So with that, we were able to provide trainings for Migrant Head Start, the fluoride varnish application trainings, and starting the early childhood education program. So the table toothbrushing programs. And we used a resource called Catch Healthy Smiles and it's an online web-based training out of Texas. And then our internal also pre-COVID internal cross-collaboration. So I kind of had already talked about that, but leveraging our existing relationships and collaboration within our other public health programs. WIC, for example, in addition to providing resources and information, how to find a dentist, because that is asked during their education sessions with their participants. We also joined WIC in celebrating their WIC graduates. So WIC goes up to age 5. Well, that's about the time folks, little kiddos are heading to kindergarten. So we are incorporated some COA information into their WIC graduates efforts. And then another recent collaboration. So it was pre or post-COVID, but we had done other things like this with our CalFresh Healthy Living team. One-time special events at schools that we may not have a relationship with, but they do. Recently, one school site had hydration stations installed, and so we were able to collaborate with them and incorporate some health education along with Rethink Your Drink and build those connections with the school administration and personnel and start some dialogue about the importance of oral health. So, but during COVID, when everything kind of pumped the brakes in schools, kiddos were not in school. One thing that we were able to do to kind of keep that communication and bridge and maintaining the engagement and relationships that we had established was once we found out about the grab and go school meal program, we had reached out and said, hey, can we provide you, some oral health kits, dental services shut down completely during COVID while healthcare stayed open. So, and just a reminder and toothbrushing charts, and we were able to package those up and get those out to the school sites. And as they drove through and got their healthy school meal, they also received some education and their oral health kits to keep practicing healthy behaviors. The other thing that we did during COVID is we leveraged the things that were going on during COVID. Well, our county put together a mitigation meeting with schools on how to mitigate COVID, and it continued on. And it's been now converted to our healthy schools and how public health programs can support schools and their scholars in keeping them healthy. So I utilize this meeting also to like in February and October, highlight oral health and throw out there for when schools to gauge readiness for when they were back in schools and ready for us to potentially come into their school site. So that was a great access point for our program to still stay kind of in the forefront and kind of in the background at the same time. And then post-COVID, so full re-engagement to expand our efforts, we conducted, so the team you saw, minus Chewy hadn't joined us yet, conducted a pilot project with 3 of our high-need schools in our largest school district. And we did a school-wide oral health screening. We did that to, and actually reach, I think, around 1,500 kiddos. And it allowed our program to also collect data to then compare to what we found with COA and to see if they were telling similar stories, which they are. And they also represented older kids. So we were able then to utilize data to then communicate the further need for additional schools. And that dialogue is still going and back and forth and on. And sometimes those things take some time. So perseverance, highly recommend perseverance. And then planning and prioritization. So in developing our implementation plan for our school oral health programs, it included our model, which we are starting with school linked. I'm really transparent. I would love to have the money to continually provide a school linked program every single year. We cannot. As you saw in previous slides, there's high need, there's a small team, and we only have so much money, and we need to be equitable with those resources. So what we do is we offer to come in and conduct the first pilot year and train and build the capacity of the school then to sustain, and then also establish shared performance measures and then also support ongoing technical assistance and quality improvement in those things, and some sustainability strategies. So leveraging existing policies and things in place. That was one of which was previously mentioned with our MCP and things like that. So next slide. So what did we do this year specifically for back to school? We had Chewy. This is for our social media post, but we had a roaring good time helping our friends get ready for school at Riverbank through one of our family resource centers with Casa de Rio. We did kindergarten roundup, COA. And then Kirchen Elementary, they do a roundup, but it's for the entire school. So we supported that. And then Modesto City Schools, actually in partnership with Modesto City Parks and Recs, holds a back to school night backpack giveaway. And across these 3 events, we reached pretty close to 2,000 kiddos. So we were busy this back to school season. Next slide. And where are we going? So our model and our approach, as I mentioned, is school linked. And what I described was, we call it a soft launch pilot approach. So I'm very transparent with the schools up front, and that this could be considered a pilot program. You'll have great data. You'll have relationships built with dental providers and clinics. And then sustainability and options to fund the program ongoing. We'll have cost projections for them, and then they can make informed decisions and plan accordingly. So that's kind of how we coined our approach. And then planning and partnerships, it's a continual readiness assessment, kind of like I used the COVID school mitigation meeting, which is now the Healthy Schools meeting. We still are engaging our early childhood educators and building up their capacity and getting kiddos ready when they're entering kindergarten and COA. And then, of course, our schools and school districts and dental providers, our FQHC. And then where it says technical assistance and support, that's really us, as well as our managed care plans. And then quality improvement and sustainability. So a big piece of that is these partners right here in the middle listed. They're really ongoing wise to help support schools in sustaining their oral health programs. We're hoping to launch our community of practice. That there is a mechanism and a group to help not only the continuous quality improvement, but for accountability and sharing out. And then also whenever there's a lift, if many are helping lift, it's not as heavy as just a few. And how we are planning to go about doing this, I'm hoping this school year, I think Riverbank is interested, is leveraging existing policies. So for those of you that don't know, your CalFresh Healthy Living partners are going to probably be working with schools. If not, schools may be asking for their assistance because they will be required to update their school wellness policy. There are new nutritional guidelines coming out for schools, and I believe that's 2025, so next school year. So we're going to
Sure,
work
if I can ask you to finish like within the next 1 minute, so we have
Yeah,
enough time
I'm sorry,
for the next
next slide.
speakers, and we will cover all of these in the Q&A session.
Okay,
Thank you.
that's it.
Thank you so much for all of the generous sharing, all of that. Thank you. So with that, we are going to go to our next speaker. And if you can go a little faster so that we can have some time, and we're going to cover more of the details about partnerships and all of that. So I will give it to our San Francisco team.
Great. Thank you, Dr. Bahar. Good morning, everybody. My name is Bernadette. I'm part of the school-based oral health program from the City and County of San Francisco. We're excited to be here and to share with everyone about our program. Next slide, please. So this is our current school-based oral health team. Again, my name is Bernadette, and I am a registered dental hygienist. My colleague, Deanna, we're both the main dental providers for our program. She's also a registered dental hygienist. Marina Spiegel, you'll hear from her within our presentation. She's the local oral health program manager. Dr. Helen Yu, she's the current interim director of dental services. And we're fortunate enough to have an AmeriCorps member join us. Her name is Jamie Lee. She will be helping us with the coordination, scheduling, and the database of our program. Just background information, this program has been a longstanding partnership with San Francisco Unified School District, and we only service to one school district. And we provide free dental screenings as well as free dental sealants. And next slide, please. So I'm going to pass it along to my colleague, Deanna.
Hello, everyone. Or are you muted?
No.
I'm not muted. Okay, sorry. So I am going to go over our current programs. We have 3 programs, our kindergarten screenings, and we service 73 schools. Last year and in previous years, we actually had 74, but unfortunately, one of our schools has closed down. We also have a fluoride varnish program for pre-K and TK, and we go to 49 schools. And we also have a dental sealant program for 2nd and 5th graders, and also 1 middle school. And in total, that's about 32 schools. Unfortunately, with our MOU issues for last school year, we did not conduct kinder dental screenings, but we did do our fluoride varnish and dental sealants. And we screened for sealants, we screened about 1,635 students, and we sealed 1,115 of those students. And for our fluoride program, we screened 1,139 students, and we were able to apply fluoride on 940 of those students. Just for previous data in 2022-2023 school year, we were able to screen 3,090 kindergarteners. So we are hoping to do about the same this upcoming school year. So for our future goals of the program, I think one of our biggest struggles is care coordination, and it's something that continuously kind of like falls through the loop. So that's what our main focus is, trying to figure out how we can improve our care coordination. We're always looking to increase consent rates and reach as many students as possible. Increase our oral health education in all schools. So in addition to our programs, our AmeriCorps member, she also goes out to the schools when we hand out consents, and she provides our oral health education and includes a nutritional counseling within her presentation. And then our other future goal is to improve our database. Our program is longstanding, and our database is also pretty dated. So we are in the process right now of updating our database to a new program, which will probably take effect in another year or so. Next slide. So this is just a quick photo of what our setup looks like. All our equipment is mobile, and and we work in all sorts of different areas. So the one listed as JY Chin is actually under a staircase, or we'll get a classroom, the nurse's office, auditoriums, wherever we are welcome. And next slide. I think that's it. So thank you so much, and then we'll answer more of the questions during the panel.
Thank you so much. Very much appreciate that. So with that, I'm gonna give it to Erica to give us an overview of her program.
All right. Thank you, everyone. It's so encouraging to hear what everyone's been doing. My name's Erica Hagstrom-Dossi. I'm a registered dental assistant and the program director of the Smile Keepers Dental Program here in Tuolumne County. Okay, so as I said, or as the slide says, the Smile Keepers program has been providing care in Tuolumne County for the past 30 years. For the last 25 years of our journey, we have been based out of the Tuolumne County Superintendent of Schools office, also known as the County Office of Education. So our office is based out of the County Office of Education, and that has multiple benefits. We have been, Dr. Kumar, dear Dr. Kumar, considered us a legacy program by the Office of Oral Health. And we currently have about a 93% participation rate with our schools. And we serve 11 school districts. Our community is not unified. So each of our school districts are their own community. So yes, we provide MOUs like crazy. We provide service to about 4,800 children yearly in our community. That includes TK through 8th grade, all special education students. And we also have about 500 preschoolers that participate in our program. I've listed the different funding sources that allow us to participate in all these activities. We are entirely grant funded. We receive no county money. I write all the grants and do all the reporting. We also have a wonderful infant oral care program that we provide at our local hospital, teaching in the birthing classes about parent oral care and infant oral care, send them home with beautiful little kits. We also have an adult clinic at Behavioral Health, which is funded through the MHSA, which is Mental Health Services Act. And this is a grant-funded program we provided for 18 and above for community members that are unsheltered, struggling with mental health, and many, many elderly patients that we serve. That's been going on for the last 10 years. We also provide expanded services at our local juvenile hall. Our county schools office provides education for the students in juvenile hall. Therefore, they become Smile Keeper students. And for the past 2 years, we have been providing advanced care services there, cleanings, sealants, silver diamine, fluoride, and care coordination for students that are incarcerated. When children are incarcerated, they lose their Medi-Cal benefits. And so we coordinate with the jail to provide services. And then we had a team of dentists that were providing free care here and there. We also picked up our sister county, our lovely, lovely Calaveras County last year, and partnered with them on a First Five program. And we work closely with their wonderful LOHP project at Calaveras Health and Human Services. And before I talk about our partnership with our local LOHP, we have also opened a virtual dental home. And if you're not familiar with that concept, it is a 5-year grant. It's a HRSA grant with UCSF Pediatric Dental School. And we have opened a little dental office in the mountains near Yosemite. And it has been an incredible project. We welcome you to come and visit. That's all I can say. Any Tuesday you want to come, please come visit us in Groveland. And when the LOHP grant came into Tuolumne County, we immediately partnered. And I hope Maura's on the call today, but we partner with our local LOHP to target 5 of our most needy schools. And we do dental screening and fluoride varnish in cooperation with our LOHP as a special project for the Office of Oral Health. We've been testing a screening model that could potentially be used throughout the state. So that has been a wonderful partnership with our local oral health program. When we had our agreement with the local oral health program, we had to sign a data sharing agreement, of course, had to do an MOU. So that has been a really positive project for us. Okay, next slide, please. All right, here's some of our strengths. We have a lot of fun. Working with children is an amazing experience, and we make sure to have fun, even goofy fun. But some of our strengths is that we over-communicate. We don't assume anyone remembers we're coming. We over-communicate with schools. We're also reliable. When we schedule our school screenings and our back-to-school nights, our virtual dental home, we schedule 6 months in advance, and people know that we'll show up. So being reliable has been an incredible quality that we value. And we're driven to provide top quality care. Our program employs 2 RDHAPs. We have an active care coordinator that really works extensively on our virtual dental home and is able to assist us in other capacities of our school-based program. We are consistent, which kind of goes along with reliability. We have the advantage of being in our schools for so long that it is considered part of school. And we know when to pivot. Oftentimes, I'm sure all of you have come into schools where there's a substitute, they forgot you were coming, it's chaos. We know that's a great time to say, can we come back another day? And having that flexibility from our end going into schools makes us much more accepted in our school districts. I may have said this before, but we train all our staff. We are guests in a school. Just because we're all ready to go doesn't always mean that it's the best time for schools. So we really read our environment so that we can come back and be successful. And we're transparent. Anyone can call us from anywhere across the United States, across the world. We share our resources. We're open to suggestion. And we have a lot of fun. So I go ahead and go to the next slide, please. We wanted to show, we recently had a short film made about our project. And this was a labor of love. This whole project was donated to us. It was paid for by a private citizen who believed in our program. And we just want to give you a short clip of what our program is about. And the link to the film will be available in the chat. So let's go ahead. So how are your teeth today? Pretty good? Okay, you taking care of it? You brushing them? You flossing them? Yeah. All right, good. Are you taking good care of them at home?
Yesterday I was sleepy, so I forgot to fix.
Well, you know what? Okay, the deal. Don't forget tonight. The thing is,
Smile Keepers is a school-based dental disease prevention program, providing care in our local school districts for the past 29 years.
We go into classrooms and talk to students about brushing and flossing and healthy food choices. We screen their teeth for areas of concern. Then we provide a fluoride varnish treatment. All services are done with parent permission. When needed, we help parents connect with dentists for follow-up treatment.
I think sometimes having a dental professional talk to them versus their parent is really helpful. Just one-on-one, kind of explaining to them why we're taking care of our teeth or showing them the plaque on their teeth and explaining what we need to do each day to care for them.
Dentistry is often a difficult experience for children and adults, and our goal is to create a safe, happy, fun experience for children the first time that they see a dentist.
Smile Keepers goes to early Head Start centers and almost all of the local preschools. In addition, we teach new parents about infant oral care and provide newborn kits.
Smile Keepers services approximately 5,000 students, and that would include infants, preschoolers, and school-aged children in our K-12 schools. You could never see 5,000 students and that many students in a clinic. Because we have a school-based program, we go to where the students are, and we see them right there in their classrooms. And so because of that, we're able to serve 5,000 students within our county with this school-based program for Smile Keepers.
Smile Keepers serves all of the elementary school children in Tuolumne County, as well as high school students who are in alternative programs, special education, and juvenile hall.
Okay, so that's just a short clip of our film. But what this is allowing us to do is to spread the word about oral health. And because we are grant funded, this is a modality for us to create a funding revenue. And we can talk more about it, but that's really the gist of what we're doing. So we welcome everyone to visit us, and please keep up the good work. Thank you.
Perfect. Thank you so much, Erica. And such a great video to share with us. Thank you. So with that, I would like to invite our panelists to come to our virtual room. Imagine we are meeting in person and we have this panel in front of you and you're sitting in this big room of 115 people. Amazing. Okay, so let's see if we can do it. If you go to your view, you could see, I think there is a way to look at like the multi-speaker thing so that you get more sense of like a panel. So with that, as you have heard, we have amazing work in front of us. So I'm gonna start with a question to San Francisco about your strengths. We heard about different programs. Tell us, what do you see the strength of your programs are, or your partnerships?
You want to take that, Deanna?
Oh. So I think one of our biggest strengths is that our program has been established for many years. You know, we have been in the school district. We're one district. It's a city and county. Everybody knows like we exist and we're here to provide services. And, Bernadette and I were hired a little under 2 years ago. So when we first started, not a lot of people knew our faces. And so what we realized is that partnership with our nurses is so important. So every Sealant school especially has a school nurse, and we've made sure to really focus on those partnerships with the nurses. And in return, our consent rates have really improved over time. But Bernadette and I focus on communication. We make frequent visits. We always provide presents and incentives for our staff, the school staff members. We also join all the nursing meetings in the beginning of the school year to give every nurse a little refresher on our programs and how important their participation is. Do you have anything to add, Bernadette?
So you've covered mainly the relationships with the schools. Fortunately, we have good rapport with the school nurses. One exciting thing that we encountered yesterday, one of the school nurses reached out to us. So it's great to see that they're excited to get started for the school year. And our MOU was just passed last week. So good timing, and we're ready to get started and serve the students and families of SFUSD.
Perfect. Thank you so much.
Yeah.
And I know your program has kind of expanded over time, like, the way that you have been in certain schools and you have expanded, you have had COHA across the city, county, and you have expanded to more of the school-based programs. I think, Marina, you were going to say something. Sorry, I cut you off.
Oh, no problem. I think just kind of from the LOHP perspective, one of the strengths, besides like having Bernadette and Deanna have those great relationships with the schools, we also have had community task forces that are funded through the soda tax, through our local city soda tax, that go into specific communities, into our Chinatown community, into our Latinx community, into our Black African American community, and provide some of that education about the importance of those. What's a sealant? What is, fluoride varnish? What is the importance of signing and returning that consent rate at their child's school? So they do that community engagement that in the most kind of culturally and linguistically appropriate and accurate way, so that those schools that have that community partner to supplement the work that Deanna and Bernadette are doing are also getting that added education. And I think we have seen that that's resulted in higher consent rates in those particular schools. So that kind of community partnership, as well as that soda tax funding that I think somebody else asked about, like, how do you pay for the sealants and the fluoride varnish? Like, it's that added funding through our local soda tax that has really been a success and helped our program be successful.
Mm-hmm. Perfect. And I remember when I was going through my dental public health residency some like 15 years ago, I was involved in San Francisco oral health strategic planning process, which started then. And then as part of that, as you said, having these kind of local groups and task force, and then now that LOHP is established, kind of really strengthening that further, it really helps you kind of tailor the strategies to different neighborhoods. And you're a smaller county, and that also helps to have these tailored strategies, right? So yes, so very much appreciate that. So I'm going to move on to Stanislaus County. So Sherry, you shared amazing details about your program and where you are. How would you say is your strength? Like if you were to say one of your best things that you have got.
Similar sentiment and theme. There's no way we could go at this alone. Good luck to anyone who tries. And I think I jokingly always say, like, I'm human windsock, or our team, we're just are flexible, we're okay. And meetings, Erica mentioned it, meet schools where they're at. Now it may not be a good time to talk about this, and we'll circle back to you. Or even our other side of not just schools, but like our clinic side, we're changing our electronic referral or their EMR system. Okay, I'll come back to you in January when you've completed that project, because we don't want to step into that mess with you. Just those things, I think, being mindful of your partner's needs too. And it's okay to have put in 3 months of planning and something happen. They will appreciate it and they will be there, rather than trying to force something. Is just not a great approach. And I think just be innovative about your partners. And once you have a little bit of success, I'm so jealous of Smile Keepers and Erica's awesome video. Because once people see success, they're like, oh, I want to be a part of that. So even if you're having success and it's not in schools, share it, and then that'll entice schools, along with the what I call, like, for us, the Debbie Downer data of, like, this is not so great, but hey, this is what we could do about it. Like, look how fun it is.
Right.
I think those aspects, just be really innovative. Think about the partnerships you already have and how you can utilize those, and then to build off of the relationships that you have gaps in.
That's great that you say that. I was hearing a colleague that was talking about how to use a storytelling in sharing the data. And what he was saying is that, like, share what is not going well, but also make sure that you share what is going well, right? So kind of, you're right, like showing them like the COHA data, here's what we are, here's what, is not good, but also here's what is going well. And I think you do a great job in kind of balancing that act with your partners. I remember from a conversation, Sherry, you told me the story of like a school district superintendent or leader that was not open, and then you found a way around it working. Tell us that story.
So longstanding partner, but I'm going to chalk it up to competing priorities. I heard from my immunization person not calling back to, and of the overall health services for our largest district. And so I'm like, bummer. I really want in there. But we have great relationships with the 3 schools that we did the small pilot with, and the after school programs, and the student support services coordinators. And those are the folks in the office. And it's like, okay, well, if we have to tackle school by school by school or a section of the district at a time, awesome. But I met on another project with one of my contacts, and I was like, yeah, I'm really disappointed. I haven't heard back. I've been trying. Oh, let me schedule a meeting. And so it's, again, leveraging those partnerships and not giving up, but also not like, why aren't you meeting with me, and pushing it. Just wait. The universe and the stars will align. And
right?
It'll circle back around. It always does. So,
That's so great.
Yes. Patience.
That's so great. No, I really believe in the stars in our public health work. Fantastic. Thank you so much. And I'm going to go to Erica. Erica, thank you for sharing all of this amazing work. What do you think is your strength of your work? If you were to mention one thing about the strength.
I would say we hire top-notch professionals and we lead with love. first. And that breaks down many barriers usually. So I would say that we lead with love in everything that we do. And I would say that was probably our biggest strength.
Mm-hmm. Love it. Thank you.
Oh.
I remember when we were talking, Erica, about how uniquely, you are a group of dental professionals that you go to schools and you work with community members, and you are located in the Department of Ed. That's where you're situated. So it's a very kind of unique situation. If you were to give any word of advice or any word of things for LOHPs to think about when they work with dental professionals or with the Department of Ed, what would you say that is?
I would first say to remember dental professionals, if you're working with dental professionals first, they are professionals. They are the experts. And oftentimes we're very lucky because we have a public health heart. But if you're bringing on providers who are not familiar with public health dentistry, that we all do, to, again, like Sherry said, meet them where they are first and talk to them about how beautiful your schools are, the problems that you're seeing. Talk to them about experiences in their own office that, frustrations they may have in not being able to treat children. Something that will tie them in with your mission. And when you go and make decisions or bring ideas to the table, run it through your professional team so that when you go to the schools, you're on the same page, everyone's speaking the same language. And in working with the County Office of Education, for a long, long time, I felt like a square box trying to fit into a round hole in education. And what we've done is that the county office is the heart of business in schools. We are we're the ones that pay the bills. We're the ones that write the contracts. I mean, not me, but all my wonderful coworkers. And so honoring the county office as the beginning of your success, they can offer so many services for you within the school districts. If you have LEA questions, if you have MOU questions, a lot of the county offices employ it's called a Joint Powers Authority, which is the risk management piece within school districts. They can be your best legal advice. And, I feel so fortunate. My JPA director is right across the hall. And if I have any questions about permission slips, about LOHP agreements, about MOUs, I can run them through. And so anything that comes out of our office is vetted and careful.
Perfect. Thank you so much. And that's a good segue to ask one more question. I know we are short on time, but I know San Francisco has had their own challenges with MOU as well. If you want to share whatever is appropriate to share about what you learned from that process when your MOU process last year took a little longer, what are some lessons learned about MOU?
Oh gosh, yeah, the MOU took us a long time, and I'm going to ask your forgiveness. I don't know all of the obstacles because I am fairly new with our LOHP, but one of the biggest setbacks was actually on our Department of Public Health side, was about who were the dental professionals that were going to go into the schools and what liability the department was taking on as a result. That was the biggest obstacle that we unfortunately haven't quite resolved. Because the Department of Public Health said, well, if we used to rely on volunteer dentists from the local dental society who would come in and do the screenings and sign off on these screenings and feel good about themselves and do a great service too. But it was always an informal relationship. And now, like on our department side, legal or the risk management team said, no, they have to be vetted, they have to be approved, they have to go through the fingerprinting and the blah, 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 and the blah, 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 and the blah, blah, blah. Because if anything goes wrong, the department will ultimately be liable. And, we have to make sure these staff are vetted. The problem is that process is expensive and takes 6 to 9 months. So we haven't been able to figure out how to resolve that. I think that was one of the biggest obstacles to our MOU being processed. So at this point, it's just Deanna and Bernadette doing 72, schools worth of kindergartens and, half the schools of Sealands. I think we're looking at 6,000 children for some type of service. So, our kind of backup alternative is that, okay, maybe we can pull a dentist, we can pull the dental director, out of some meetings.
Right.
Maybe we can pull some dentists out of clinic, if they want that kind of community-based experience. But that was one of the main things that was holding up our MOU. And we just kind of had to be like, no, we need this MOU to go through and we'll figure out how to deal with that obstacle when we get to it.
Perfect. Thank you so much for sharing. And I know we are at the time, but I want to kind of close with a really appreciation of all of the work that you do. So we're going to go around the room, our virtual room, and each person just say like one thing that, like in one sentence, that's their hope for this year. Just even if one word. Erica, what's your word or sentence?
Growth.
Growth.
Just growing,
Thank
growing
you.
personally and growing our program.
Perfect. Thank you. San Francisco, one of you, tell us, what's your word of encouragement or hope for this year?
Providing access to all students and families in San Francisco.
Perfect. Thank you so much. Providing access. Yes. And Sherry?
Continued collaboration.
Continued collaboration.
Yep.
Perfect.
Collaboration, collaborative spirit, keeping it alive.
Yes, definitely. Fantastic. Thank you for making this magical panel come to life. We make sure to answer all of your questions, the people in the audience later, and hopefully we'll bring this group back together at some point. And with that, thank you, thank you, thank you. I'm gonna give it to Gary from SCOHR to give us a quick update on SCOHR. Thank you again.
Hello, everyone. Can you guys all hear me okay? Can you guys hear me? Sorry.
Yes.
Okay, awesome. Thank you.
Yes.
So we've got some exciting things happening over at SCOHR. I'm glad I can be with you guys. There was a chance that I wasn't going to be able to make it because I had a last minute meeting, but that one ended a little sooner than expected. So I'm happy that I'm able to join. I wanted to discuss a couple things with you guys. We've got some exciting things happening with the SCOHR system. I know Aubrey was kind enough to send me some questions that were submitted. I'll do my best to answer some of them. Some of them, I think we're going to just have to do a separate training. A lot of them had to do with data and how to enter data. And so I want to make sure that we address those things. And I've worked with CDPH, and we're going to schedule some trainings for specifically for participating and for non-participating, 2 separate training classes, because really the data is collected and entered into SCOHR differently. So I wanted to just talk about that first. The other thing that we are excited about is we've worked with CDPH, Shannon and Paula and her team. And I think I saw Rosanna on here too. We worked with them, and we're actually going to take a different approach this year. And this may answer a couple of the questions that came through the survey that Aubrey was kind enough to send. We are actually going to be uploading, and we're close to finishing that upload now. But we also run at COHTAC, we also run the dashboard, the CDE dashboard. So what we are doing is we're taking that same exact list from the dashboard and we're going to enter that into SCORE. So all the schools data information will be accurate with the CDE dashboard. So some of the schools that were missing or some of the schools that needed to be added, that should be taken care of in this upload. This is going to create some continuity between the CDE systems. So that way, we know that all the schools are very serious about entering their information in CDE to making sure that the dashboard is complete. So this will alleviate some of those issues that we had there. The other thing that we want to make sure that we reiterate is that both old form and the new form are still available to be used for this upcoming year. We do have the new form on the site, but if you are doing the upload, you do have the ability to do the old form there. We also are in the process of removing, so the participating districts, we are in the process of also removing some of the identifying information. So the identifying information for the students, the personal information section and the addresses will be removed from the waiver form, the actual assessment form, and there's one other form. Let me pull it up here. But it's going to be, all of that data will be removed from the SCORE system. That way, again, it's not something that is needed. The assessment, the waiver, and the demographic. And now I want to kind of switch to some of the other questions that we received. We did receive some questions in regards to who can have access to SCORE. That's not really a question that SCORE could answer. That's something that CDPH would answer. And I know they are tightening up a little bit about they're getting a little bit more strict in who they actually give access to, because we are dealing with still sensitive information. So the questions about who can have access to the system, that would be something that we would direct you to SCORE. To CDPH, excuse me. Trying to kind of go through this. Some of the questions were, I've never used the system before, would love a walkthrough. We don't have time to do a complete walkthrough, and like I said earlier, because there's two different user types within the system, we want to make sure that we separate those two trainings out for the participating and the non-participating schools. And that's another overview question, so we'll do that in the trainings. Best way to contact SCORE is through the SCORE help desk, and that's score@sjcoe.net. We did get another question: how do other counties track their results? Again, that's not a question that really we would be qualified to answer here. That would be something that we would encourage you to reach out to some of the other districts or counties. Let's see, we have a question.
Yes. Yeah. Hi, I am, and this question may be, I don't know, a little silly because I'm new. We've been trying to get our contacts at CDPH to answer the question. We have 20 years worth of district level kindergarten screening data, and like our LOHP hasn't been entering any data into SCORE, which I'm trying to fix. But our question was, so the school district, has its own number. Can we add the school district as, kind of as a line item for a school so that we can add aggregate data for those past years? Because I don't have those data broken down by school that easily accessible, and it would take us quite a lot of person power to, find it, to enter it, but if we were able to do it kind of like, here's a whole school district snapshot that we could do, and that would give, everybody that much richer data. So, but our question was like, if there was a line item for like the whole district, as opposed to like, here's one elementary school, one elementary school, one elementary school. If we could have that added, how would we go about it? Or is it at all a possibility?
That would be a question that I would defer to CDPH. That's not something
Okay.
we would make our updates based off of what's coming in from them. As it stands right now, it is broken down by school, so I would have to defer to CDPH on that.
Okay, but on a technical level, it's possible. Like from a software perspective.
It would be, but there'd be a lot of programming we would have to do to make that happen. So any updates that we make would have to go through CDPH. Yeah.
Okay. Thank you.
You're welcome. So I think Aubrey, those are the updates that we have for the SCOHR team. Once we have dates scheduled for our trainings, we'll send that out to the groups, and we'll also put it up on the sites. Aubrey, I know we're short on time, but I do see one other question, one hand up. I don't know if you want to.
Yeah, thank you. Sheree, do you have a fast question?
I think so. You kind of touched on it. Is the enrollment data from CDE going to be included in SCOHR? So then we know in one place whether or not we're reaching all of our enrolled kindergartners, TKers?
No, it's just for the schools. It's just making sure that we have all the schools.
Oh, just the school.
Yes, we're not doing any. We don't ever, and that's why we're removing the personal information. We do not store student data system.
Thank you.
And Yadvir?
Yes, I just wanted to ask if there are any plans to integrate like school systems with SCOHR in the future. If the schools are entering data into, for example, ARIES or other systems. Has there been any thoughts around that?
We haven't had any discussions on any of that. That would be something that I would have to discuss with, again. I'm not trying to pass the buck to CDPH, but our contract is with them. So any type of decision that would require more work, we would have to discuss that with CDPH before we make any decisions.
All right. Thank you, Gary. There are a couple of questions in the chat, if you don't mind looking in there to see if you can answer those. And if we can't answer them right away, we'll be sure to answer them in our follow-up. I'm going to run through just a handful of other things that we want to share with you before we leave today. So let's do that as quickly as possible. All right, this is on a lot of people's minds. There is a bill, AB 2630, that is sitting on the governor's desks, which would add TK to COA. This has not passed yet. We expect it probably to pass. And what we have to share with you today is that everyone is working really hard to support implementation, and we will communicate updated guidance as soon as possible, but nothing would happen right away. So we will share more information as soon as we can about this. You heard a little bit about this. UCSF hosts a dental public health residency program. Dr. Bahar Manzdeh was one of the residents that went through the program. And residents are dentists with an MPH degree. They receive hands-on experiences in various aspects of dental public health. And we're hosting an information session on Thursday, October 10th from 11 a.m. to 12 p.m. if you're interested in hosting a DPH resident at your LOHP. So we'll be dropping in the chat some more information about that, and it'll be on our COHTAC website as well. And then lastly, COHTAC's next Share and Learn. So in October, we will be talking about tobacco and advancing oral health. That's on October 17th. You should have a save the date on your calendars. And then in November, we hinted at this a little bit earlier, but we'll be talking about care coordination. And we're hoping to have DHCS or Gainwell there to share more about that form. And we'll be talking about some of the LHP care coordination models that you all are already doing. So that is to come through the rest of this calendar year. And that's all I have to share. So I know that we ran through a lot today, and there's a lot of questions that we maybe didn't get to, but I promise we will as soon as we can. I just want to thank you all for being here and for all the presenters for sharing the wealth of information. I really appreciate all of you. And I hope you all have a fantastic rest of your Thursday. Thanks so much for being here.